Thank you very much indeed, everybody, for joining this session. I hope you've been enjoying the conference so far, that you've found plenty of time for networking, found your way around that lovely room layout. I think it's terrific the way the portal replicates a real conference as much as possible. And welcome to this session. It's a real privilege and honour to be chairing this session where Dr. Lisa Saldana will be talking about customising the stages of implementation completion tool that I think many people here will be familiar with. So welcome, Lisa, welcome everybody. Lisa is a senior research scientist at the Oregon Center for Social Learning. She's been involved for many years in the development and the evaluation and supporting the implementation of evidence-based practices with a particular focus on supporting families in the child welfare system. Of primary relevance for this talk is the work that she's done developing the stages of implementation completion tool, which is a terrific tool that measures and monitors the progress through 8 stages of implementation. And Lisa and her team are developing it to a 9th stage. I'm sure many people here will be familiar with it. We certainly use it at the Centre of Evidence and Implementation and find it extremely helpful. I should have introduced myself. I'm Jane Lewis. I'm a director at the Centre for Evidence and Implementation and based in the UK. We've used Lisa's tool in a number of studies and found it enormously helpful. Lisa's work also involves developing programs, most recently the Families Actively Improving Relationships program, supporting families affected by parental substance abuse. She's carried out a number of pieces of work developing and testing practice and supervision support methods to strengthen implementation. Somewhere in there, she's also found time to develop the costs of implementing new strategies tool, developing work on the costs of implementation, which is a very scienced area of implementation, and so that's a particularly important area of work for development as well. So it's a real pleasure and an honour to introduce Lisa. Lisa's going to explain the stages of implementation completion tool and particularly discuss the pros and cons and the processes involved in customising it to make it more adapted and more tailored to particular implementation situations. Once Lisa's gone through her talk, there'll be plenty of time for questions. So we'll invite everybody to unmic, to come off mute to ask questions. But if you'd rather put questions in the chat function, then please do. It's down at the bottom of your screens and I'll keep an eye on it and call those questions out on your behalf if you'd rather do it that way round. Over to you, Lisa. Thank you very much.
Wonderful. Thank you, Jane. Oh my gosh. Thanks, everybody, for coming. I was going to say good morning, but I know that for many of you, it's good afternoon, possibly even good evening. But for me, it is good morning. So thank you, everybody, for coming. I do, as Jane so generously described, I have been working on the SIC for the last 10 years. And I'm going to be sharing with you guys today some of the more formative work. For folks who have seen me talk before, some of these slides might look familiar, but I hope that we look at them through a different lens today. Really, as Jane described, we're going to be focusing on customizing versus adapting the SIC. What's the difference between that? What are sort of the pros and cons? When would you do one versus doing the other? And how might this be useful to you in your work? So again, recognizing that some folks have seen some of these slides before, please forgive me for that. But again, it's because we're going back to basics and then we're going to talk about it in a different way. As Jane described, I'm really hoping that I'm going to talk at you guys for about 25 minutes or so, 25 minutes. And then after that, I really hope that we're going to open it up for a rich discussion to see how it is that the SIC might be able to help you in your work. But I'm also happy to entertain questions about implementation process in general and how it is that we might be able to advance all of the good work that I'm sure you folks here on the call are doing today. So again, thank you. I'm going to go ahead and pull up my slides and then, like I said, just talk at you for a little bit here. So, and when that happens, I won't be able to see you, just so you know, because I'm on a laptop at a hotel right now. I don't have a double monitor. And so please, if I'm discussing things, feel free to come off mute and just interrupt me while I'm talking, because I won't necessarily see your facial expressions or see you, raising a hand. So please interrupt. This is for you guys. This does not need to be formal. So making sure that we get all of your questions answered. All right, so let me pull up my slides here. All right. All right. So again, thank you. I'm just so delighted to be here. I wish I could be there in person. I was really looking forward to this conference, but I will have to catch you guys next time when we can do this in person. So again, talking about customization versus adaptation today. I'd like to thank my funders. All of this work has really been funded by the National Institute of Health, primarily NIDA or NIMH. And then my SIC team, which is ever growing. We have folks now kind of located around the country that are helping us as we operationalize and learn more and more about this work. So to begin with, I just wanted to start a little bit. This has been coming up a lot, I think probably all over the world, this issue of health equity. And I've been thinking a lot about how implementation process can actually help us in our goal towards achieving health equity. And so folks might be familiar with this particular article that was written by Anna Bauman and Leo Cabasa, but really they identified 5 different elements where implementation science could really help support advances in health. And I think 3 of the things that they identified are elements that really speak to the need to work on quality implementation process. So one is focusing on reach from the beginning, really trying to identify how are you going to reach your population? And in order to do so, we need to, of course, be effective and efficient. Second is designing and selecting interventions for vulnerable populations and low resource communities with implementation in mind. So of course, to be able to do that, of course, we want to say, oh yes, we want to go and help this one particular vulnerable population, but to be able to really do so with quality and not just put a head nod toward, to ourselves and saying that we're doing this, we want to make sure that we can understand what are the processes that that particular community might be able to handle, might be able to conduct well, so that they can also have a good quality implementation. And then finally, really implementing what works and developing implementation strategies that can help with the health inequities in care. And so again, I feel like if we can develop, let me back up just to say, I really feel like implementation science has a lot of opportunity if we take it to be able to do good quality process, which should help us mitigate some of those inequities in care currently. So how do we do that? We do that with the implementation process models is one thing. And so I think all of y'all are familiar with Pierre Nelson's work where he describes the implementation process models and what they are. And the SIC is one of those. And so this is really where we're talking about guiding and translating the process between research into practice, recognizing that there's a temporal sequence to these activities, and really specifying stages or phases of implementation. And so that's exactly what the SIC does. So how do we do this? How do we achieve this strong implementation process and fidelity that I've been talking about? So again, some folks might have seen this, but I really like to bring it back to what is it that we think about when we think about fidelity? So many of us have it drilled into our heads now that we really need to think about quality and fidelity in delivering interventions. And so what does that mean when we're talking about fidelity in the intervention context? We're talking about adhering to key treatment components. So what are the key elements or the mechanisms of action for a treatment to work? And delivering those components with competence. And when we do that, that's where we end up establishing treatment integrity. And so again, as I mentioned, part of the way that you do that is that helps us to understand what are the mechanisms of action for the intervention. So what are the things in the intervention that we don't want to change because we know that that's part of the secret sauce that makes the intervention work well. So I'd like to take that exact same thing, and then we do that as an analogy for understanding implementation fidelity. So now when we think about implementation fidelity a little bit differently, we're thinking about performing implementation activities with both adherence and quality. And folks will ask me sometimes, well, what's the difference between, the intervention activities versus the implementation activities? And I hope that by the end of today's session, we'll be able to answer those questions. And with the goal then now is to increase positive implementation outcomes. So of course, in order to establish those, the good quality implementation, we want to consider both of these things. We want to look at intervention fidelity, but then also implementation fidelity, how those things work together to establish overall positive implementation and clinical outcomes together. One without the other isn't very helpful. So to do that, now we're going to understand what are those mechanisms of action that make an implementation work. And that's really where the SIC is situated. Before we get started, I think folks are also familiar with Greg Aaron's EPIS model. I do recognize, Greg and I work very closely together, that he has advanced the EPIS model greatly since this original figure. I also know that this is very blurry and we can't see it because I don't need for you to see all of the different components of the EPIS model. What I want to show is that this spans the full phase of implementation. So oftentimes when people think about implementation, they really start about it at the active implementation. So really stage 3 here of the EPIS model. And what we're talking about today really is focusing more on these pre-implementation phases, which in the EPIS model includes exploration and preparation. So the SIC. For those of you who are not familiar with the SIC, it was created out of necessity, really, and I happened to be at the right place at the right time. So I do not deserve credit at all for coming up with this notion of how do we measure implementation process. Rather, it was Hendricks Brown and Patty Chamberlain. They were just starting a head-to-head trial of 2 different implementation strategies. It was a multi-component strategy with lots of different steps to it. And they were really trying to examine what's the best strategy to achieve successful implementation for the same evidence-based practice. And in this case, it was TFCO Oregon. And so I happened to come on right when they were launching that project and was given the task. I had done some measurement and development in the past. And so was given the task of trying to help figure out how was it that we are going to measure this implementation process. So I was able to observe over 51 counties in 2 different states here in the United States. It was an iterative process and it was really based on observation. So I was observing different counties to see what was it that they were doing and what was it that seemed to be necessary as they were making the decision and then ultimately implementing the TFCO model. It's a date-driven model because we want to make sure that we're able to capture the nonlinear progression of implementation. And so this is not just like a do this, like sort of stepward ways, although it seems like that. It seems on paper that it looks linear, but I think we all know that implementation, you take a few steps forward, you take a step back, you take another step to the side, you take another step to the other side. And so by having this be a date-driven measure that allows us to be able to look at that variation and that variability so that we can see the optimal paths for implementation. And it spans these 3 phases: pre-implementation, implementation, and sustainment. So the SIC itself, you can see our website here noted up at the top, but the SIC now, again, these 3 phases, we have engagement, feasibility, and readiness planning, which are part of the pre-implementation phase, and that's what we're going to spend most of our time talking about today. And then we have in the active implementation phase is when you're actually hiring and training your staff, getting your fidelity monitoring systems in place. So this is for your intervention fidelity, because this process itself is to achieve implementation fidelity. Then you launch your program, you're doing your ongoing services, and then hopefully what we're doing is we're working towards establishing competency and then sustaining what it is that we have implemented. So across these 8 stages, as we've mentioned, there are different people who are involved at different times. So sort of the who, what, where, why, and it's really important. So what I have outlined here are just sort of the basics, but of course, depending on your implementation, the who is involved at different points is going to look very different. What you'll see here is that we we definitely want to have our system or agency leaders involved in the pre-implementation process. But depending on the type of implementation that we do, let's say that we're doing something that's more community-based participatory, we might have our clients, we might have our target audience also involved in those early stages. So it's really up to you guys, depending on what it is that you're doing. But the point here is that there are multiple players that are involved in the implementation process. They sort of come and go throughout that process. And when measuring implementation, we want to make sure that we're capturing the activities that all of these different active agents are doing so that we can really decide what is the proper operationalization of that process. Here are some sample activities. So within each of the 8 stages, there are a number of different activities that sort of describe or define that particular stage. I'm going to be talking to you today about some of the core sort of components that we know, but depending on your implementation, we have operationalized some where we have, over 180 different items across these 8 different stages. And so it really depends how micro you want to go and how complex your intervention is, how many individuals are involved in that intervention. But when it comes down to it, we then break them down into these very small, very digestible, easy steps, and they all are driven by a date. So as you see here, we have, for instance, the date that the first stakeholder meeting is taking place during the feasibility process, or the date that you get your technology set up in stage 5 here, where you're looking at your fidelity and adherence monitoring being established. So we really want to focus on the dates in which something was completed. We're not thinking about the date in which something starts. We want to know the date in which that activity is completed and completed well. We know that there are 4 different missing data types. If some of you guys have heard me talk in the early stages of early days of the SIC, we did not know this. And so this is something that is newer. We've uncovered in the last, I don't know, probably 4 or 5 years. But in our analyses, what we were came to understand is that not all missing data is created equal. And so indeed, sometimes data truly is missing and it truly is not completed. But oftentimes, if we look at the implementation process, we might ask ourselves, well, gosh, if an agency or a site, especially one that's under-resourced, was trying to implement something and they'd already done some of these activities for a previous implementation, well, we think of those as expansion activities or being part of an expansion team. It wouldn't make really much sense for that agency to go back and do that again. So for instance, if you're coming up with a 24/7 sort of on-call policy, well, that wouldn't be something that you need to redo. And in fact, it would be a waste of your time and resource if you tried to. Sometimes it's also not applicable. That could be due to geographic variation or due to the population that you're implementing with. And in that case, it's truly not applicable. And then very importantly, again, with the SIC being date driven, we do know that there are some activities that happen. We know that they happen. We have evidence that they happen, but we don't know the date in which they happened. In those cases, we still want to log and indicate that that the activity took place. And in fact, in so doing, what we're really doing then is we're marking the adherence to those activities. So as we were talking earlier, adherence versus fidelity, this is making sure that we have the adherence, even if we might not necessarily have the date or the knowledge of the pacing. So the SIC produces 3 different scores: the duration, proportion, and stage score. Duration is the amount of time that it takes to do all of these different activities. Proportion is obviously just the proportion of activities that are completed of those that are recommended. And then the stage score would be a score of 1 through 8, which is how far along in the implementation process a site goes. I should say that these can be scored at the individual stage level. So you could end up with 8 scores for each of these different score types, or at the phase level, which is what we typically do. And so that's looking at it from the pre-implementation, implementation, or sustainment phases. And so we have scores for all of those. The SIC now, I'm going to describe how we've done it across a whole bunch of different implementations, but suffice to say that the summary of outcomes, for those folks that have heard this, It hasn't really changed over time. We really consistently find that the SIC is reliably able to distinguish between good versus poor performers, and to reliably distinguish between different implementation strategies. We find that pre-implementation consistently predicts successful program startup and discontinuing programs. We can tell the programs that are probably not going to make it into the future based off of their pre-implementation. And then, of course, the combination of pre-implementation and implementation helps us predict the development of competency. So now, really the meat of what we want to talk about here is the adaptation or customization process. So we have now a pretty standardized process where we operationalize individuals' implementations. And so it's collaborative and iterative. Pre-COVID, a lot of times I would fly places and sit down with folks and spend a couple of days with them, really understanding what their implementation process is to help. This is for the adaptation, I should say. For the adaptation process, I would fly around and do that. Really what we want to do is define what does the completion of an implementation activity look like. So it's one thing to say, I'll give an example of the stakeholder meeting. It's one thing to say, well, we had a stakeholder meeting and we completed it. We planned it to be 2 hours and it was done. So that would be one way of saying completion. But what we're really looking for to be able to look at this idea of implementation fidelity is, was that stakeholder meeting conducted well from the perspective of the site? And the way that we really have done that is to determine with a proxy of, were the right people in the room that we need to conduct this implementation. So if you're doing something in the criminal or juvenile justice system and you need to have a judge there and you have 20 people there, but the judge doesn't show up, we would therefore say that that stakeholder meeting was not completed because your key stakeholder was not present. And that is the key stakeholder that you need to really honcho the implementation. And so part of what we do in this adaptation or customization process is define, what does completion look like? We then want to make sure that we also understand the decision rules for validity checks. So for example, can you see a client and say that that client is being seen under this intervention if you have not yet trained the interventionists in that intervention? So if the therapists or the clinicians are not trained and they're seeing clients, the validity check lets us know, oh, but they haven't been trained yet. So whatever it is that they're doing with that client, we don't want to count yet as the intervention. And so we put that in our scoring protocols as our validity check so that it triggers a red flag for us in our scoring. We compare what we say is the skeletal SIC, which is after we've gone through this process together, getting it down on paper so that we understand what is it that we're programming. And then we do an iterative back and forth process with the site to make sure that what we have defined reflects reality for their implementations. We've done this with over 55 different sites now across multiple service sectors, and all of this data that we collect feeds into our SIC repository. So the thing about deciding whether you want to customize versus adapt really is going to be focused on, what are the resources that you have available? What's the developmental phase of the evidence-based practice that you're working with? What are the questions that you want to have answered? And really, are you doing this with monitoring versus facilitation? Are you trying to guide sites towards a quality implementation? Or are you sitting back and watching and tracking and monitoring what it is that they're doing? And those two things are different. So for the customization process, which is what I'm going to talk more about here, as I was asked to, the customization process really relies on what we call the universal SIC. So as I mentioned, we've done this with over 55 different practices, different EVPs worldwide. And what we found, we did some reliability coding across a group of us, and we continue to do this now. Every single time we do a new adapted SIC, where we build it from the ground up, where I'm meeting with you, where I'm understanding your implementation process, and we're really looking to see from a very formative space, what is your implementation process? What are the steps to that implementation process? And what are the expectations for completing each of those steps? When we've done that, we then do a reliability exercise and we do what we call linking. And we link the data. I've got to check the time here. We link the data To what we've now defined as our universal SIC items. The universal SIC is composed of 46 items. So again, as I mentioned before, if you're doing a tailor adapted SIC, you might end up with something, like over 100, 180, whatever, however micro we go steps. But for the universal SIC, we're looking at 46 key component activities that have been identified across these other implementations. So when we're customizing a SIC, what we are doing is not changing the activities, the spirit of the activity, but instead what we're doing is we're overlaying that with the semantics or the words, the language that's appropriate for your implementation. And so what you see here on this slide, the numbers out to the side are the number of activities per each of these stages that show up in the universal SIC. So what you see here is not surprisingly readiness planning, and then the ongoing service delivery or quality assurance monitoring. That's where we have the majority of our items. That's where we spend the majority of our time in our implementation process. The universal SIC itself has strong psychometric properties we found. We did Roche modeling, and we're able to have reliability and separation as we would like. And now what we have is our SIC platform, which is, I'm not going to go through the platform with you, but just to say that it's a web-based platform that everybody who uses the SIC and contracts with us, of course, you don't have to contract with us, but if you do, then that data goes into the SIC repository, and the SIC repository then is a de-identified way for us to learn more about implementation process, and that's what kind of fuels the rest of what I'm going to be showing today. So currently we're tracking over 1,900 sites worldwide across these very different types of service sectors. So schools, justice system, primary healthcare, hospital settings. And we are actively right now on our website tracking 49 different practices. We have other practices that we had worked with in the past, but they have now discontinued because their projects are over. We use the SIC, and what feeds into the SIC repository are both real world implementations as well as academic implementations. So here we are again with our rubric or our paradigm of the SIC. And based off of these 19, so I just did this the other day, so 1,903 sites, of those 54% have discontinued. Folks have heard me talk in the past, and I always show this slide, and I hope one of the things, if you remember, I know it's so much detail and hard to remember, but I hope what you recognize is that we are starting to actually move the needle on this. So when I first was presenting these slides some years ago, we were talking about 65% were discontinuing at that time. At one point, it was actually 69%. And slowly we have been dropping this down to now where we have 54% discontinued. So still over half, still an unacceptable amount in my opinion that we want to have move forward, but we are moving that needle. We have about 29% that make it to program launch, or that start a program, serve a first client, and we have about 12% that achieve competency. This 12% competency score has not really changed over time. So that is the part that that we're really focusing on right now. How can we get folks, how can we get sites to move between actually starting a program and then getting to the point of delivering that program with quality? So now a little bit of a different, these were data that were pulled down from last September. So at that point, we had 1,788 sites, and we had 29% of those sites that again make it to program launch. So very similar to the slide that I just showed. But now I'm going to talk a little bit about sustainment. So of those 29%, so we're a very small sliver of the 1,788, 55% of those achieve competency. Okay, so that's great. So over half of them achieve competency, but again, we're talking about a very small sliver. But then do they end up sustaining, and what does that look like? And what we find is that depending on how you define sustainment, we see again a pretty big drop. So if we define sustainment as 2 years post startup, so post this 29% where you're launching your program, we've got about 35% that end up sustaining. If we then move, though, the goalpost and say, well, we're really interested in, are they sustaining competent programs? Now we have about 22% that end up sustaining before we end up discontinuing those programs. So again, more for us to move that needle on. But also, I am cautiously optimistic because this is showing some improvement from where we were a few years back. So pre-implementation then presents the greatest opportunity to move the needle on success, and in my mind, to help us promote equity and receipt of evidence-based practice. And so again, the three stages here are what equate pre-implementation. So now I'm going to go through what does this look like. These are the core components out of the universal SIC. So of course, if you were operationalizing or creating your own SIC, you could add to this. You could have as many items to engagement as you want. But regardless of the implementation that you are that you're conducting, we know, of course, that the site needs to know that the thing exists. They need to express interest in it, and they need to let us know that, yep, we've decided to consider implementing. The reason why we say consider is because we know that just because they agree to implement does not mean that they're going to actually be able to carry that off. And so that is why we have this consideration here. This again probably looks familiar to some folks, except I would caution you, because when I showed these slides, I don't know, probably up to 4 years ago, we were at that point saying that that if you did all of the things in stage one, so all of these engagement activities, you would only have less than 50% chance of launching a program. We now say that if you do all of those programs, our data is showing that you have about an 80% chance of launching a program. So again, the field has moved the needle in terms of this engagement stage so that we are able to help work with agencies and know from the beginning whether or not it's a good fit. And if it is a good fit, giving them the information so that they can make those decisions. So to me, this is really exciting that we are starting to move that needle. And so if you decide, yes, you want to do it, you then need to determine, is it feasible? And so these again are those 4 activities that are just the core components to feasibility. You need to have a planning contact, right? We want to have a stakeholder meeting so that we can understand from stakeholders' perspectives if this is going to be feasible to pull off. Some sort of a feasibility questionnaire assessment to know whether or not an agency is going to be able to conduct the really necessary components. And then, of course, I think not surprising to anybody is identifying a program champion, because we know that how key they are. We've also learned from this work that when you do not have a champion or somebody who's really leading an effort, that is one of our signals, one of our red flags that an implementation is not going to be successful. And now when we do that, we see that we really move the needle. I mean, so we get a great big bump if we do all of our feasibility activities with our engagement activities. And so now we're much closer to having at least the potential of achieving a successful implementation. And so across the bottom here, I should have explained, are the proportion of activities that are completed. And so obviously with the more activities that you complete within a stage, that's increasing your proportion score. And so your probability of program startup increases. Then finally, readiness planning, which is the stage that I know a lot of people talk about a lot, and this is where a lot of effort goes into. When we look at these activities, it's your communication plan, stakeholder meeting, readiness planning, and this is where we get our big bump. So this is if you have to decide where you're going to put your efforts and energies, we know that you really want to put it towards readiness planning, because if you do all of your readiness planning activities, there's a very good likelihood that you will be able to launch your program. One thing I want to point out, though, is that, again, there's this issue of duration and quality that we want to keep in mind. This graph shows, this represents every single agency represented here was able to make it through pre-implementation. But what we see here are that those sites that are certified, those are the ones, the certified sites, they do it at a quicker pace. And so we don't want to go too fast, but we also don't want to go too slow. So these sites that made it all the way through the readiness process, they conducted their implementations at a slower pace, and they ultimately ended up discontinuing. So I'm just going to breeze through a couple of slides here to show you that there are different ways to get there, though. I don't want to imply that you have to do everything in the same order or at the same pace for success. So this is an example. This is all of the data sort of combined together. And this lets us know that in order to hit an 80% probability of success by 2 months, that this is actually the fastest pace that you can go. If we go any faster than this, if you're conducting more than 80% of your activities within 2 months, you're going too fast. And so we really want to make sure that we're giving time to be able to do all of our implementation activities with quality. And then if you do this, then you can do a steady pace and you can achieve successful implementation. So again, this graph is really showing that if we need to, this is the fastest pace that we can go and still do well. This graph, on the other hand, shows that in fact, by this 2-month mark, this agency only reached 40%. And 40% of activities completed. They kind of go along, but then we see that you start to reach a point of diminishing returns if you are not doing enough activities at a fast enough pace. And so you can recover though, and you can recover by doing a whole lot and then doing it at a steady pace after that. This is one where we see that they achieve that 80%, and then they just sort of plodding along before they achieve success. What's different between this and the first graph is that because they achieved that 80% within this very nice timeline of 2 months, they set themselves up to where it was almost like they set themselves up to not be able to fail. And so that's a very, very nice quality implementation. And then finally, here's an example of one that's got a real slow start. But then they're able to pick up the pace here at the 5th month, and then ultimately are able to achieve success by picking up that pace and doing everything with good quality. So this final slide here, I just want to show really is emphasizing the importance of pre-implementation, because what this slide shows, I know there are a lot of lines here, but ultimately this is showing that if you do an excellent job with your active implementation, so you train the right staff, you've got all the right people in place, you've got, you're receiving clients, you are implementing that, delivering that intervention with fidelity. If you do all of that, but in the absence of a good quality pre-implementation, so down here are the pre-implementation proportions, you still will not reach sustainment. So the only way to reach sustainability is you must have a good quality pre-implementation. So good implementation in the absence of pre-implementation, good quality pre-implementation still does not get us to success. So finally, just as I was mentioning, just in sum, so the SIC is a measure of implementation fidelity across the full process. It really matters what you do and how you do it. The decision to customize versus adaptation, it's pragmatic, and you want to consider the questions that you're answering, and then really facilitating strong implementation with a new context can help target those issues of equity. So now this is where we're going to pause just for you guys to sort of think, this is what I was thinking that we could talk about for our discussion. I know we have some time to do that. And so really, what does it take to make it happen for your own work? And so some key questions that I was thinking about are, what would successful implementation look like for you in your implementation processes? Who would it involve? Who are the people? What would sites look like? Do you know what your implementation process is already? You need to ask yourself that as you're deciding whether you're going to adapt versus customize. Do you know how to define competency and what your progression to look like? And then also looking at just the reality of, do you have the resources for data collection? So I am going to now stop share so that we can have a conversation.
Well, that was just absolutely wonderful, Lisa. Thank you so much.
I've heard
this data before a couple of times, and I'm just endlessly impressed by a couple of things. One is, well, by loads of it. I think it's just the most beautiful, nuanced, and eminently usable illustration of the real dynamic of implementation processes that, lots of us are working with all of the time, but it displays it so absolutely beautifully. And I think that very, very powerful message about the importance of pre-implementation activity, I mean, I just can't hear that often enough. It's so important, and your data on it is so impressive. I'm also really impressed by the emphasis that you and your team have consistently placed on constantly testing and retesting the reliability and the validity of the SIC, and really holding yourselves up to very high scientific standards around that. So absolutely brilliant. Thank you.
Thank you.
much. Brilliant. Can I just ask of the audience, first of all, with a show of hands, how many people, wave your hand around or use the hand up symbol if you have used the SIC in your own work? How many folks have? Not a lot of people. And how many folks are aware of it, you know, have read about it, have heard Lisa talk about it before?
Like just a couple people.
A few people.
Yeah.
And how many folks have ever wondered or worried about implementation phases and stages and pre-implementation activity and so on? Yeah, I rather thought that would be the whole lot of us. So whether or not you've used the tool, we've all of us seen the sorts of challenges that the SIC really highlights so beautifully. So Lisa, that's just been so helpful and so useful. Just are there any immediate questions for Lisa? I've got a couple that I wanted to call out, but if you have a question, you can either put it in the chat or stick your hand up, use the hand up function. I can see that Lisa, sorry,
looks
Leslie.
Like Leslie
has got a question straight away. Go for it, Leslie.
Okay. Thank you very much for the great presentation. I have learned a lot. Actually, I was involved in this project related with trying to de-implement low value clinical practice in a region in Spain. So it was a project related with, well, with the 3 levels of healthcare: primary care, hospital level, and nursing. So for me, it has been very interesting, your presentation. I have 3 questions, quick question probably. What were the key reasons for the ones that stop being involved?
Yeah. Okay.
The other will be how long usually it took them to keep going, you know, until they stop. And what were the key elements for those ones that actually reached the sustainability phase? Thank you very much.
Yeah, thank you. So I think I can answer those. I hope so. For the key reasons why different agencies discontinue, of course we don't know for all of them, but in our qualitative interview work, what we found is, not surprisingly, a lot of times it has to do with financing and lack of resources. This to me is sort of a tragedy on our part, though, as implementers, because part of, if we're doing good quality pre-implementation, we should be preparing sites to understand what are the resources that are going to be necessary and help them in those very early stages develop a financial sustainability plan. And so I think often what happens is that folks start their implementations that are grant funded. We all know that, right? You get the grant or an agency raises their hand because we're going to give them some money to implement this thing. But I think it's our responsibility to not just give them the money to implement the thing for us to do our research project, but then to be able to help them really develop those resources that they need. And that's where the cost of implementing new strategies comes in. But that really, I think, is the thing that we hear the most. I also hear a lot about, particularly for programs that got started and were able to go along pretty far in the process, it's around turnover. So if you experience turnover, especially at a system leadership level or at an agency director level or a champion level, and the agency does not put another good champion in the program, those are times where we also see programs discontinue. And then, of course, there are sometimes when programs discontinue simply because the population need and population characteristics have changed. And so if there's something that's going in for a very targeted effort and you have already, like, let's just take these vaccines, right? Like if you're doing a vaccination effort and you've been able to vaccinate everybody in a particular community, then that implementation is going to probably move on to a different site. So those are the key reasons for discontinuing. How long really depends on the implementation that is, or the intervention that's being implemented. I will say that, as I mentioned in those last slides, really doing any sort of pre-implementation any faster than 2 months, regardless of what it is, if you're implementing a device, if you're implementing a complex intervention, if you're implementing a simple intervention, you really need at least a minimum of 2 months. When we're talking about the complex interventions, so that those are like more of the psychosocial sort of behavioral health interventions, where you might have a family component and an individual component and a provider component. Those pre-implementation processes take between 3 and 6 months. For any implementation, if you go beyond 9 months, it's a red flag. If your pre-implementation is taking longer than 9 months, that's a red flag. How long, though, to your question of how long does it take before sites discontinue? That is really all over the map. I don't have, there are a lot of sites that discontinue very early on. And in those, I actually think that is good because they haven't put a lot of resources into something before they discontinue. But there are many, many, as you saw from those sustainment slides, that make it all the way to developing a competent program and still do not make it beyond 2 years. And so they discontinue all along the continuum. The key elements to your third question, I think, really speak to the universal SIC items. And so I would encourage you to look at those 46 items as being sort of the most common key elements that you would want to include in any implementation for success. Thank you, Leslie.
That's brilliant, Lisa. Thank you, and such a lovely, clear, crisp account of the durations that we should be aiming for and seeing as red flags. Thank you. Jenny, you've got a question, and then there's a couple in the chat which I'll come to as well. But Jenny, go for it. Thank you.
Yeah, thank you, and thanks so much for your presentation. This is an excellent model, and it's really impressive to see all the data that you've collected. It's very well done. I'm very excited to learn more about it. In my work, I do a lot of work on implementation and clinical practice in the field of rehabilitation. Often our implementation projects start from clinicians who learn about a new evidence-based practice, and they're very excited to implement this new practice. So a lot of our efforts are quality improvement kinds of efforts and not necessarily grant funded, although we have been able to get some of these projects funded as well. But because they're often generated by the clinicians, there is so much excitement and so much eagerness to actually jump straight into the implementation phase. And it's really hard to get them to slow down and put the same efforts into preparing for implementation. And I'm wondering if you have any tips or advice on how we can get more buy-in for this phase and helping them understand the importance of this phase in implementation.
Yeah, I think that that's an excellent question. And of course, it depends on sort of the culture and climate of the setting in which you are working. But I most definitely think that, I think data speaks myself. And so I think that if we can show these different providers, one, we want to leverage the motivation and their excitement, right? We absolutely don't want to lose that. And so if we can encourage them to think about sometimes immediate gratification is not what is going to get us to the actual end of our goal. They're probably excited about it because they see the great clinical outcomes that are achieved. And so if we can really highlight for them that in order for them to achieve their goals, which is good patient care, that we would be able to do that we have to have the infrastructure underneath us. And so I like to talk about it as a safety net. There's without fail, I think all of us know our clinical interventions, we're going to have hiccups and we are going to have the kinks that we need to work out. We're going to have crises that happen. And the only way that we're going to be able to weather the storm of those intervention kinks is by having the safety net of good quality infrastructure underlying us. And so I would encourage you to maybe think about messaging it to them in that way. I don't know if in the different type of rehabilitation implementations you're working with, if you have metaphors that you could rely on to really bring it back to their work, if there are things that they do to help prepare patients prior to taking a big leap in that rehabilitation effort, that I would do that. I would link it there because again, it really just does come back to having the support underneath you. You have to have a firm foundation to stand on in order to be able to do the big heavy lifting.
Thanks, that's really helpful. And I think all the data that you guys have collected and the way that you've analyzed and looked at it will also help us in showing that, hey, this is what we've learned from this model, that we really do need to build this infrastructure. So thanks so much. I appreciate it.
Thank you, Jenny. Thank you.
That's great, Lisa. Thank you. And I really love that idea of drawing practitioners or organizational leaders' attention to the aspects of their practice, which they would see as foundational in, you know, of initially building the relationship with the client, for example, the kind of activities that they wouldn't leap straight into. I think that's a really nice approach. I'm just going to call out a couple of questions that are in the chat. So first of all, from Martina Roers, who asks if and how is the client involved, since participatory research is so much required in research. Where do client service users come into the SIC?
Yeah, I think it's a really great question. And I would put that back to you in terms of it really depends on your implementation process. And so if you are using a community-based participatory approach, then I absolutely think that the client and the patient should be involved all the way in the beginning, really even in the engagement process. And so if you are an agency that is using that approach, then you would want to reach out to your key constituents, or at least representatives, an advisory board or somebody from that group, to find out, is this intervention that we're considering the right fit for your community and for the work that we want to do to be able to address those needs. And you could include them all the way through. So even in the feasibility planning process and the readiness planning process, having folks involved there. I think where it's probably less involvement might be in the delivery of the training or the setting up of the fidelity monitoring, but that's not to say that they aren't even involved in that process, because I would hope that we would have, if we're using a community-based participatory approach, that we would have their input into our training materials, the format of our training, and the same thing for our fidelity monitoring, that we wouldn't just impose our fidelity monitoring system, but instead we would find out, how does this fit for your culture, for your climate, for your population characteristics. So I personally think that you can involve the client the entire time, but it really just depends on the process and the approach that you're working with. Some of the more traditional purveyor approaches, of course, don't do that. And so you, as the implementer, as the person who would be honchoing it, I would expect that you would introduce that to the purveyor and say that that's important to you. That's an important part of your implementation. So I don't know if that's helpful or not, but yeah.
That
Thanks.
sounds
It was. Thanks a lot.
really
Great. Thank you, Martina.
I'm just going to go to a question that, Susie, your second question in the chat function, which I think links with this nicely, which is curious about how to manage disputes and disagreement between stakeholders about what the completion of an implementation activity looks like.
Oh goodness, this is a great question that I do not have a straightforward answer to, but I have a little joke that I tell people all the time, which is that I'm a clinical psychologist by training. And this is when I use my clinical psychology degree, is when I'm in those stakeholder meetings, because indeed that absolutely is a challenge. And I don't have, again, a straightforward answer. I think that you know, all voices need to be heard, and we really want to make sure that whatever our final decision is something that is going to be doable. Oftentimes those decisions and those disputes are around something that practically does not make sense. So somebody might say, well, we need to consider all of these different characteristics before we can say that an activity is completed. We need to recognize that there is somebody that is tracking this. There is somebody that needs to observe these different activities and then ultimately document them. The SIC is intended to be a very low burden tool, but you can make it really, really high burden if you get into all of those different micro steps. And I would ask the team when we're in those stakeholder meetings, what are the bare elements? What are the bare essential elements of this activity that need to be conducted for us to be able to move forward in our trajectory of our implementation? We can make it as fancy as we want, but sometimes keeping it simple is our best course of action. But again, that really depends on who is in the room and sort of what those relational dynamics are. But that's the approach I tend to take.
And Lisa, do you find that bringing it back to the client and the service user and the family or the person at the center of it helps there as well? I've sometimes found that to be quite a good cutting, as you say, cutting across the complexity and just saying, look, well, what actually matters to service users here? And that can sometimes not necessarily produce consensus, but kind of help some of the kind of lack of consensus to drop away.
No, I think you're right. And again, I think it really depends on what it is that you're implementing. Like, so if it's an individual, like sort of treatment intervention, or is it more of a community-based intervention, or a provider intervention? And so, yeah, but I think you're absolutely right. Yes. And I think that's something, though, Jane, that we should be reminding ourselves of in everything that we're doing when we're operationalizing it, that this ultimately comes down to the patients that we are trying, or the communities that we are trying to serve, and making sure that that's always on the forefront of our mind when we're creating our processes.
Yeah, that's really helpful. Other questions? Who'd like to add something else in the chat, or put a hand up, or just come off mic and call out? Just scanning across the.
It's like Leslie has another question, perhaps.
Oh, go for it, Leslie. Good spot. Go for it, Leslie.
Thank you very much. Thinking about the project, more or less, I wanted to ask you if you can share some criteria that you usually use for selecting and prioritizing the stakeholder groups, for weighting the level of time and resources that we have to give them.
Yeah.
Because some groups have more power, more influence, more legitimacy. So how to deal with that, especially because, as you have said, we are, that as technical group, usually we are a limited number. So
yeah,
more or less, thank you very much.
Yeah, no, again, it's a great question, and not one where there's a specific answer. I would just say that that, as you said, there are power differentials that you would want to be aware of. You want to make sure that if you invite somebody to the table, that they actually have a seat at the table, and that they aren't just there because you're giving a head nod to them, but that you actually are going to listen and consider their input. And I also, I think that you can have power differentials in a stakeholder meeting, but we want to set up ground rules and expectations at the start. And so what is it that we're trying to achieve? Why is it that we are all here at the table? It's because we all have something important to add, and that is going to be key. And then as a facilitator, I think it is our job to make sure that we are giving everybody at that table that equal voice. And so I think in terms of deciding who is there, that's really, again, up to who, like, what are your needs when you're implementing? So who are the key folks that you need to have to make this move forward? But less important would be, or less important is who is there, and more is how you facilitate that conversation. And I guess that's not true what I just said. Less important is who is there, because it is really important who is there. But regardless, I guess, of who is there, we want to make sure that we facilitate that well. And Leslie, if you have questions about that, I would encourage you, feel free to email me or reach out to me if you are getting together a stakeholder group and you would want to see like how we might navigate some of those power dynamics. I'd be happy to share with you over email different examples that might be specific to your particular research project, because it does vary depending on the project.
Thank you very much. I highly appreciate it.
Great.
Yeah.
I'm going to come to Hasker's question in the chat, but just very quickly first, Marguerite has asked, do you have an overview of all the stages and data items per stage? She couldn't find it on the website. Could you just quickly point us?
I do, and you know what, if it's, so we have a universal SIC, and we have the universal SIC, it has all of the descriptions on there. Now that you mention it, I think you might have to have an account to access that. So what I can do, again, if you would, anybody on this call, if you would like to email me, I am happy to send that out to folks as an attachment, no problem. It's just a couple pages. And what it does is it'll just give you the universal SIC items. I want to tell you that the way that the items are listed, it's very generic, because again, we customize them for your implementation. And so read the generic item, but then next to that, we'll have a description of what the spirit of that item is, so that you can determine how that would best fit for your implementation. Yeah.
That's brilliant. Thank you. What a lovely offer, Lisa. Thank you. And then just quickly, Hasker's question is, would you say that the SIC is meant more for designing your implementation, or monitoring its progress?
So it was developed to monitor progress, but more recently, folks are using it for designing. And so it can be used both ways. In fact, right now, we are working on analyses to see if the psychometrics are different on the project or on the SIC, depending on how it is used. So hopefully I'll be able to answer that question for you next year. But I would say it can be used in both ways, and we use it in both ways. I have a current grant right now where we are using it to facilitate implementations. We're combining it with the treatment fidelity aspects of different treatments and seeing if we can move the needle more quickly by combining our implementation and intervention fidelity processes. And so I think that there's really a world of opportunity for how you might want to use it as we advance in our knowledge of implementation. So I don't think one's better than the other, it's just different.
Excellent. Yeah, really, really interesting. Well, folks, that's all we've got time for, and it feels like we could have continued for much longer. Lisa, just a huge thank you to you for an absolutely superb presentation. I've learned a new word, which is honchoing, and I love that. I'm all over the place now. You have most definitely honchoed SIC for us. That's been absolutely brilliant. Really terrific session. Thank you so much. And thank you to
everybody.
Brilliant.
Thank you, everybody. Enjoy the rest of your conference, wherever you might be. Thank you.
Thank you. We'll all look forward to
networking
further. Thanks very much indeed, everybody. Look forward to catching up in the rest of the conference.
Great.
Bye.
Thanks.